just to be clear, most people open up the newspaper, they read everything, they listen to the news, they watch TV, and they think they're informed. Are you saying, I don't want to put words in your mouth, but are you saying from your own personal experience that government agencies such as the FCC, which oversees telecom, and the EPA, which oversees environmental chemicals, the scientific community, the media, the university community, the politicians, the medical industry, this medical and scientific and environmental journals, the social media companies, that none of these groups are open to your information and actively wanting to learn the truth? Because if that's the truth, if that's what we're saying, then there's probably a lot of topics that we're not getting accurate information. If you have great information that they're not wanting to share, then that would probably mean there's a lot of information on other topics. So is that what's happening, or am I taking this too far, that these groups are all not open to your information?
Well, I will say, as I mentioned earlier, the Endocrine Society, the American Academy of Pediatrics, the World Health Organization, the American College of Obstetricians Gynecologists, the Academy of Reproductive Medicine, all of these groups have position statements, have been receptive to this information. Many of these studies are written with people that are within these groups that have these titles in terms of their medical research and their medical training. What I'm finding is that the system itself is really kind of broken, in the sense that if you don't train doctors or healthcare practitioners at the roots of their training, then it's very hard to infiltrate with later information, because they believe it just wasn't maybe true or real, because they weren't taught by the professors and the teachers that they respect in the schools they're supposed to learn it in. So again, there's this sort of question of, why aren't we teaching young people who are going to be able to train and push these messages to people that it matters, to the actual people who get sick, their patients, their clients. That's really the issue. And I think that's a bigger question, that I can't answer, because all I know is that, if as nutrition as an example, it's very hard to get content into medical training. And it's a struggle. I think, and what I found through, messaging and building the Smart Human platform, which has grown exponentially, is that people want good information, and you don't have to just teach your patients about it. It's everyday people who are sick. There's more and more illness in many ways, younger and younger ages of thyroid conditions, younger ages of obesity, insulin resistance, younger ages for breast cancer development and other hormone-specific sensitive cancers. We are, as a culture, getting sicker pretty much younger as a general rule. I mean, obviously, it's not a very scientific statement in many ways, but what I'm saying is that I'm finding that the people who are most interested in finding out this information are the people who are directly affected by illness, food allergies, asthma, all the things that are acute as well as chronic. The EPA has many problems with it. Okay. Otherwise, we wouldn't have this pickle that we're in, where we have 90-some thousand chemicals that are running rampant in all of our products. And for instance, lead, which we know is toxic to all human beings, is allowable in makeup, in lipstick. It's not managed in makeup, in lipstick. And you could lick off, 5 pounds of lipstick in the course of a lifetime, and yet no one's really taking into account that particular exposure. And lead and cadmium and mercury are found in upwards of 75% of samples tested in one study. And we're talking expensive already, all the way to the junky chemical, cosmetic brand. So it doesn't really matter the brand. So what I'm saying is the EPA, has been tasked to do certain very narrow, specific, studies, recommendations, guidelines. They, as a public health and government agency, they're thinking in terms of large numbers, large, exposures over time. They're not really looking at mixtures. They're not looking at, in terms of individual exposures. Children, the size of the person exposed, children, pregnant women, autoimmune disease or immune suppressed people. And so we have all sorts of issues where they're labeling, lead exposure at 15 parts per million or 5 even parts per million, depending, as being appropriate. But most people would say that many of the MCLs and the maximum contaminant limits, even in water, are not safe at the levels that they're describing. So there's discrepancy on what they consider safe and what researchers consider safe, especially the type of person who's exposed over how much time. And so, yeah, that's where we have some real issues here. So, yeah, I don't want to say, in conspiracy theory, I think there's really smart people at the EPA. Unfortunately, over the last several years, a lot of them were fired. And so we have to think politically as well. I don't get political in anything I do, but let's call it what it is. Good people were fired from really important positions that really did a great job of the science, no matter what their political beliefs were. It's a problem because, the regulations are really more on the side of industry. That is just where we're at. And so anyone who stands in the way with science that's important can often be sidelined. So I'm hoping that we vote, not only with our dollars at the stores, which is what I teach young people, what you buy matters and moves the market, but who you vote for matters. And whatever side of politics you are on, you have an opportunity. And so embrace that opportunity and think about the environmental positions and the environmental health positions that the people you want to elect are espousing.
I'd like to add to that when it comes to electromagnetic fields, it's the swamp is swampy. You're deep in the swamp. Now, the FCC I've talked about, they are captured by the wireless industry at many levels, but their job is to promote communications. So let's look at the CDC. We found that the CDC, most people are aware of how the CDC at one point, actually when Chris Portier had come back from the 2011 meeting where at the World Health Organization International Research on Cancer, and the determination had been made in 2011, and Dr. Portier represented the CDC in that meeting where they determined that wireless radio frequency cell phone, cell tower radiation was a class 2B possible carcinogen, now a decade ago. He came back and he said, well, we need to update our website at the CDC. I mean, this just happened. I was there. This determination was made. And we found, as well as other investigators, that, and we did FOIA's, Federal Information Request to find this, that they wrote and rewrote drafts. They actually put something up real quick and took it right down. And then it took 3 years to get anything up related to the class 2B classification. Then there was information that was put up saying we should take caution and we should be cautious like other governments are doing. And within months, that was taken down. And the New York Times actually did an article on that at the time. Didn't capture the whole picture because the picture was deep and murky. And we have on our website a section on what the New York Times left out. Although they did capture a lot, there was a few of our emails which showed scientists connected to industry who are contacting the CDC. But there's more. We also found out in our FOIA investigations that the CDC hired an industry-funded scientist to actually write several other web pages at the time on power lines, on wireless radio frequency, on electromagnetic sensitivity, on Wi-Fi in general. And we don't know if they were aware of his industry ties, longstanding industry ties or not. But if you go to the CDC webpage now, it says, if you are worried, here's a few tips to reduce exposure, and they have like 3, almost nothing. They don't address all the ways you can reduce exposure and how you can use safer wired technology. So that's one piece, is our investigation of the CDC. You can go online to find that. We also found out with our FOIAs to the EPA, because a few years ago, the EPA website, so one of the things we do is track our federal agency web pages for the public, because anyone who wants to know about the issue, what do you do first? You don't know anything about it. Maybe, you might just go see, what does the CDC say? What does the FDA say? What does the EPA say? So we're always tracking and using the Wayback Machine and FOIAs to track what's going on. So the EPA website was scrubbed completely, turned around upside down, inside out, about over a year ago. It had already been changed to downplay, wordsmith things away. And at the EPA, they were completely defunded in 1996. But if you go to the EPA websites now, you'll find that it defers to the FCC, and you would never think there's a problem with what's written there. So we've been trying to find out what went on with that. I did get a letter from the head of one of the heads of Radiation and Air recently, confirming that the Environmental Protection Agency had not done a review on impacts that they had put forward since the 80s. And this is such an important thing, because I think we think that there's a group of scientists and experts who are researching this, and they know what's going on, and they're looking at the latest science, and they're having these intense conversations and making sure that cell phones and wireless and Wi-Fi and Bluetooth and earbuds is safe for us. But there is not. That does not exist. It's what we would like to believe, and what I definitely believed before I learned about this issue. So the EPA was defunded at the same time the Telecom Act was passed, during the most heavily lobbied time related to telecommunications. That was bringing in the telecommunications bill, Telecommunications Act. So then the FDA. Well, if you go to the FDA's website, this is the FDA that asked over 2 decades ago for long-term research studies, because they said, we don't know what the long-term impact will be. Now, if you go to the FDA, you will find pictures, smiling pictures of young people with phones to their head, and statements that, to someone who didn't know about the issue, and it is quite complex, the science, actually, if you jump into it deeply, you will think that everything is fine. And then they even have a document, a report they put forward on the literature. So, however, that report has been criticized by many of our scientists and international experts, because it didn't even look at impact to the brain or impacts to reproduction. And it states that the findings of the National Toxicology Program are not applicable directly to humans. So they are saying now that the study that they asked for is irrelevant to understanding impacts to human, when testing animals is how drugs come onto the market. I mean, testing animals is the way that we look at drugs. So the FDA website has been compromised. We're hoping there might be a change. We don't know, but we are writing and asking hard questions. We have submitted to the Food and Drug Administration, as an example, the statements, the criticisms, and the comments of scientists pointing out the inaccuracies that are in their report and on that website. We have yet to receive a response that actually responds to our questions directly. We had like about over a dozen questions. Instead, they send back a couple paragraphs that don't actually answer our questions. And then one more thing about our agencies, the FCC, we've been investigating the FCC as well with federal information requests. And we found that the issue, we asked, have you looked at the issue of an environmental review? Anytime you're going to do a big thing in the government, there should be an environmental review. You have this 5G network, hundreds of thousands of new cell towers that are going to be rolled out. Did they look at the impact to the environment, which, by the way, includes people, includes impacts to humans, in environmental review? And they sent us back a letter saying that there were documents that they found and drafts that they found. Now, I don't know what the drafts are, but they were drafts attached to the emails and documents, but that we couldn't have any of those, of that. It's all redacted because it was pre-decisional. So we don't know what was stated, but it really begs the question of, were there staff, which it seems to be, that asked about environmental review, and that, why wasn't that done? And the other one thing that's happened now is the New York Times if you search New York Times 5G, you'll see articles that make it seem like it's safe and that there's no problem. And that article is riddled with inaccuracies. I have written numerous times to the New York Times asking them to correct the factual errors that are in that piece. And they have not made any changes. There's no ombudsperson. There's no one who's actually the fact checker who is independent of the editors, as far as I know. I think there used to be an person who did that. There isn't anymore. However, in Ireland, a professor wrote to the Irish Times that picked up the New York Times piece, and it was actually found to be in violation of truth and accuracy. So in other countries, they have that checking system. So back to your question, Stephen, we're in quite a challenging time because between the federal agencies and the media, which like sound bites and quick this, quick that, not the rather complex at times and nuanced science that can exist. And scientists are not movie stars. They talk science, they talk facts, and it can go kind of deep. And it can be a challenge, I think, for the media, and they like to do quick things and then they like to counter it with the other side. So they often get industry tied comments that arrive alongside the science that's been published, or scientists that are funded by industry. And the end result is that people are misinformed and don't have the full picture and think that, well, the science isn't settled, I won't worry about it. Even though there are hundreds of scientists who are stating we have a problem, it's proven that there are biological effects of cell phones, cell towers, and wireless, and we need to do something about it immediately.